The procedure that we're going to do today is a ridge augmentation to treat the area where there's a missing tooth in the lateral incisor area with loss of papillary height and some vertical dimension problem. There is a little bit of buccal dimension problem, but not much, because we have previously performed a ridge augmentation procedure, soft tissue procedure, to correct the buccal deficiency and some of the vertical. So we're doing a second stage procedure today to try to elevate the papillae into the interproximal region and cover the root exposure on the distal aspect of the central incisor, and to fill in the papilla as much as we can in that region, also to cover the root exposure at the canine. In this view, you can see the papillary loss a little bit better, and also the root exposure on the proximal surface of the central incisor. So that is an area we'd like to elevate the papilla into that embrasure space that's been created in this provisional restoration. Now we have cleaned the cement from the teeth and flossed, and what we'll do next is assess the site to see what we wish to do. And we have an ovate ponic site already where the ponic will rest into the ridge, and that's been established in the previous procedure. So we will treat that area as though it were a tooth and make our incisions as intracellular incisions around each abutment tooth, and then also make a similar incision around the pontic site so that we really are able to raise the papilla between the abutment and the ponic on each site and create a facial pouch. So we'll begin our incisions with intracellular incisions. I'll be using an Orban instrument to place these incisions and actually enter the sulcus area. And you can see there's a considerable distance to the crest. We make this incision to the alveolar crest, and that's due to loss of crestal height on the distal aspect of the